Hello. Hi. My name is Dr. Diamond. I'm going to be taking care of you today, taking a look at your mouth, make sure we don't have any issues, and then we're just going to brush your teeth, give you a nice clean, and let you get out of here. I do have to apologize in advance. I'm not wearing the usual faux latex gloves that I usually wear. Our inventory truck is a little bit delayed, so I have to work with these just for the time being. I know that the gloves are a little bit loud and crinkly, but that's not going to stop us. We'll make sure that your mouth is in perfect shape. So let's go ahead and start. I'm just going to drape this over you here and just keep it there. That way, in case you drool at all, it does not run on your nice clothes. Alright, let me get what I need. Now, if I'm not mistaken, we don't usually do the water pick on you, do we? Because your gums are very sensitive, right? And I know you don't like that. So we usually just do the scraping, right? With the Explorer. Alright, I'll scrape off any buildup that I see. I also do have our floss picks here, so I'm going to use those on you too. Make sure that we floss really good in between and get off any dirty plaque that causes cavities. So if you're ready, let me go ahead and just get this. And I do just have the suction tube here in case you're starting to feel like you're flooding. I'll go ahead and just hang that on the side of your cheek as needed. Are you okay with me going to start and take a look around in your mouth? Alright, so just open wide. I'm going to start in the back, take a look back there and see if I see anything. You might hear a little digging, scratching sounds. That is just me making sure that none of your teeth are loose or moving. Because we don't want that. That would not be good. That could mean you have some gum loss, even bone loss, or worse. Alright. Good. And now tilt your head back a little bit, lift your chin up. Alright, I'm just going to start back here in the back and take a look. And tilt your head just a little bit. Good. Doesn't appear like anything is loose. All of them are intact. I'm noticing just the tiniest little bit of plaque on the back side of the lower teeth. Looks pretty good on the inside of the upper. But what I'd like to do is just scratch off some of that plaque buildup. And then with that, or after, we'll use this little floss pick and just go through really good. Remember, when you floss, you don't want to just go up and down. You actually want to rub on both sides of the teeth. So if you're doing, say these are your front teeth. These are your front teeth right here come together. You don't just go up and down. You want to go up and really rub on the side. And then up and really rub on the side of the other tooth. All the way up to the gum line. Make sure you get really good in there, okay? That's how it prevents cavities. And make your breath smell good, your teeth look good. All that. Okay, so let's just get ready to scrape off some of that plaque now. So using the same thing I just used, I'm just going to scrape right here on the back of these front teeth, and you let me know if you have any discomfort at all, okay? I'm not doing anything invasive. Very superficial stuff. Nothing that, excuse me, nothing that you need to get numbed for or anything that should cause any discomfort. Just the sound I know is a little bit like ugh. But all that plaque is coming off, which is exactly what we want and need. I'm just going to get above you a little bit more here. Good. And let me just use my mirror right here on the back of your teeth. A little bit more right here. And same thing right on the direct other side, right here. And I do notice, can you just open a little bit wider for me? I notice you have a few little grooves on your back teeth here. Just make sure these aren't little cavity pockets starting. Do you grind your teeth when you sleep or just during the day? Sometimes. So I noticed that on your back teeth on bottom, your last two, they have little tiny pits in them, not formed by decay, so it's not from cavities, not from lack of brushing, but I'm almost certain that it's coming from your upper teeth because they are a little bit ground down. So I'm thinking you probably are grinding and biting, clenching a little bit more than you might think. And the only reason I'm saying that is just because I would like for you to come back and maybe do an adjustment for like a night guard. Or I'm sorry, not an adjustment, an impression for like a night guard that you can wear to help protect your teeth. Because even though it's not even just about the looks, eventually your roots can shorten on your teeth, or you can have bone loss. There's a lot that comes with it. It's not kind of just like, oh well, my teeth are just being ground down to nubs, like, you know. So if that's something you're interested in, we can always see you and do an impression bite for a night guard, okay? Alright, just wanted to let you know. And now what I'm going to do is just gently floss between your teeth. And I'm also going to use this side of the pick. I'm not sure if you can see that, but it's just a little bit more of like a toothpicky thing. And I'm just going to use that if I need to, but since we already used the Explorer hook, probably won't need. Here we go, I'm just going to floss. Notice how I'm going back and forth on your teeth, not just in and out. Back and forth. Sorry. Back and forth. Now go ahead and lift your chin up a little bit. I'm just going to do the underside. You do a good job brushing and flossing. How often do you usually do it? Twice a day? Very good. That's what I like to hear. Here, let me put this suction in your mouth. Get out all that goop. Perfect. Alright, let me just see if there's any additional that we need to remove. A little tiny bit of buildup right here, very minor, and a little bit back here. Alright, just tap a little bit on these teeth up here. Okay. Are you ready to go ahead and brush? Perfect. And then once we brush, I'm just going to examine, make sure you don't have any gum bleeding or any spots that are of concern. It is an electric toothbrush. And I'm just going to get some toothpaste on here as well. And it's soft bristles, so it's going to be very nice and gentle for you. And we're going to just apply a little bit here of toothpaste. You ready to begin? Alright, open up. And here we go. Okay. Good job. Alright. I'm going to give you some suction. You can go ahead and close your lips around it. Good. Okay, how does that feel? Nice and clean? Yay. Go ahead and take a look. Good. And just with my line, I'm going to look at the back of your teeth here on top. Just see this one spot. Looks like the black kind of got just pushed up a little. Alright, let me see. Very good. Now go ahead and bite down for me. Like touch your back teeth together as if you were just biting down on your back teeth. And turn to the side for me. So I am seeing where I think the clenching is happening. That's just what I'm looking for to kind of see how your bite comes together. And I do highly recommend and think that we should go ahead and get you an impression. You can make the appointment today, or you can give us a call. You don't have to make it today. But I do think for the integrity and structure of your teeth and just the overall well-being and happiness of your mouth, we should go ahead and kind of do like an early intervention for that clenching, okay? Alright, my friend. Well, you don't have anything else that's bothering you? No pain, sensitivity, gum swelling, anything like that anywhere? A little receding? Let me take a look. Where at? Oh, right here on the incisor. Okay, let's see. Is that sensitive when I do that? Okay. So, very normal. A lot of times just over the years, our gums can recede slightly. You still have a ton of root that is under the gum line there based on your x-ray. I don't have any worry that that tooth is gonna fall out or anything. And you do not have any signs of periodontal disease, which is gum disease. None of that. Your gums look very healthy and good. They're just a little sensitive and bleed when we use that water pick. But that's okay. Many people have that. So what I'll do, just rinse with warm salt water for maybe 2-3 days, twice a day, till that sensitivity around the gum line there is gone. Should be nothing to be concerned about. We'll keep an eye if it does seem to be getting worse or not really better, because once our gums recede, they really don't just grow back. So you want to make sure that they're not receding past a certain point. And yours is not, so no worry. But if that is all that I have too. So I'll let you get out of here, but I want to see you back for that night guard, okay? Alright, friend. You have an amazing rest of your day, and thank you for coming in for all of your dental needs. You know we are always here for you. We will always make sure that you leave better than you came in, okay? Alright, bye-bye.